So, is this the only way of diagnosing a child with sickle cell?
I think there is a different way I know about diagnosing sickle cell. One diagnosis is before you become partner, you should screen yourself.
Okay.
By then, when they know that you are both affected or carrier,
Yes.
that is one diagnosis before you proceed. Then, if you don't do that, they just see your wife pregnant.
Yes.
Then there is another step that when your wife pregnant, even when you seek help that you are now reporting yourself to the authority that you have been pregnant, to your GP or something, they will refer you to the clinician outside in your area of your hospital. They will now said, oh, you are already pregnant, but let's know your genotype.
Okay.
When they know your genotype, it's another diagnosis for you because you didn't seek help on time.
Initially.
So when they now say, oh, both of you is at risk to have sickle cell child, but pregnant is already there, then the next step question or diagnosis is that they will tell you in 11 to 15 weeks, there is something they call amnofluorescence test. Where they are going to use a fine needle to aspirate fluid symptoms from your embryo or in your sac of your embryo. Woo! Right? It's a thin needle. However, that procedure doesn't do with IBA. They have to use ultrasound to guide them. Just a tiny needle. They will advance it into your alveolar sac.
No! This cannot happen. Epidural is scary enough, not this one.
Oh, that is the next step.
That's the next step.
If they wanted to do that, they will seek your consent. They will explain the procedure to you. They will tell you the complication. But most of the time, a lot of people withdraw from it because of the complications. However, the clinician will explain to you that the complication might be avoided because they are going to use ultrasound to guide them. And they will be careful not to injure your child. If they manage to take that fluid out in the sac, they will test the baby if it's a carrier or if it's affected child. Now, if they find out that child is affected, another question is, do you want to leave the child? Or do you want to abort the child?
This is what I say, emotional
damage.
This is too much.
That is very heavy. Actually.
It's very heavy.
It's a lot.
It's a lot. If you say no, one, no to amnio fluid, or yes, you did it, yes, the baby affected, and you say no to abort, then the next question is, when the baby now born, that's what we call new screening baby. Even though they find out they still need to do prick. That's happen after the baby born, within 5 to 8 days. They will prick the baby to find out. They will now compare that blood to what they have found out if you do the test of the sac. If you didn't do the test, even though they find out the child is affected, they still need to further diagnose that child again to confirm that is it really the prick test. Then in another stage of that, maybe 6 months, when the baby has formed his own hemoglobin A or hemoglobin beta, he has formed the baby as an adult. Because you have to remember that when baby is being born, they have to detach the placenta. Sometimes there is something they call high-inflating oxygen, which is hemoglobin fetal. It can retain in the baby, like enhance the baby oxygen and make baby to behave like they don't have sickle or they are carrier. So they have to now do another test when baby become grow up to 6 months or a year, and they will do another test to confirm perfectly.
Okay. What I'm learning is
that is the diagnosis.
Important.
I feel like I'm a doctor now.
No, it is very important to test yourself. Please.
It is very important
to test yourself so that you don't have to get your baby or your unborn baby or your newborn baby to go through things like this. This will be very heavy for any parent to go through. So please, this is why we are doing this, to try and get that information out to everyone. Please test yourself before deciding to come together, before deciding to have a child. Please test yourself.
So you are into diagnosis and monitoring now. You've answered so many about screening and diagnosis. So my next question is, what routine tests or what monitoring are needed for sickle cell disease?
You know, once the child is being born now, they are babies. So the diagnosis of the baby is already formed. As that baby is being born or adult being known as a sickle cell. So we need to do a clinic monitoring for the baby where mother will bring the baby. If you are adult, we have to have an outpatient clinic for you where they follow you up. In that clinic, a lot of things do happen where they will do your urine test, your blood test, your blood pressure. They have to monitor everything about you. Ask you question, how have you been for the last, how often do you have your pain? What kind of medication? Believe me, there is medication that they have to commence to use since when you are a baby or when you are adults, because some people diagnosed as an adult. They haven't been diagnosed when they are baby. Such as penicillin, folic acid, vitamin D have to be prescribed to manage your sickle level.
So they take it every day, yeah?
They take it every day because the folic acid will help the child or the adult to replicate more red cell, because you remember your red cell always breaking down every 10 days. But the more it's breaking down, the folic acid will be helping you to produce more and boost more blood.
Fetal hemoglobin.
Fetal hemoglobin. Another thing that the penicillin will do is when we are sickle cell, they do have what we call spleen secretion. The spleen is always fighting against bacteria, but sometimes when they have, because we have said the sickling always blocking the blood flow to go into organs, it damages some organs like spleen, liver, kidney. So we have to be giving penicillin when they are baby, to be using this to prevent further complication of infections, right? And the vitamin D will help you with your bone because it's a black bone and black generation condition. They don't see sun. We need some sun
especially in the UK,
to be strong in.
that's right.
So those medications are very compulsory medication. But on top of that, sometimes in between your management, you're always having pain. We need to manage that pain with pain crisis, pain relief for you to have it at home. Is your pain relief they give you, is it working for you at home? It's something we need to monitor. You need to report back when they are checking. We have to gain your consent to put you in Party national registration in case at anywhere you go, they know that you have sickle cell in UK. But it's with your consent. So there's something they brought out of recent that is always helping us to manage patients better, because there is a lot of things that have been happening that when patient presents to another hospital and they don't know what patient before they call the hospital, patient pain delay and things like that, we call it universal care plan. So we have that now that we put in the patient plan. So anywhere you go in UK, they can open universal care plan and treat you accordingly.
Because we have a patient we're talking about. Where did she move to? And
Sheffield.
She moved to Sheffield, and the hospital that she was did not know how to manage her as well.
The problem was they thought she was on too much medication in London,
UK.
and as such, they started to reduce her medication over there. They didn't want to follow her care plan. They started building a new care plan, and she's not happy at all about it.
It's not even about being happy. She's struggling and she's suffering in pain.
Okay, I'm going to advise in future for people out there who are the warriors, who have the sickle cell, and you are moving from one town to another town, from area to another area. The first thing is that contact your clinician that you are moving or you are changing house, you are moving to this place, or your GP. The most important thing is where they are looking after you before. Your consultant should write a referral letter, or your GP should write a referral letter to any area where you are going. I know there's some area in UK where the way we are doing London is different from outside because of lack.
Tell me about it.
Yeah, because
we have several cases of
the disparity is too high.
It's too high in the sense that just depend on the local area where we find our Afro-Caribbean, isn't it? If you don't find much of that condition in that area, they might not know a lot. And I think that's what might affect your friend. However, if your friend is moving, he can actually connect with his consultant, GP, to do a proper referral. Write everything down, what is using to manage the pain crisis. And when he's going to that place, they can recognize and continue the management for her.
Okay.
Apparently, the problem now is they're not following it.
I think if they are not following it, it can report back to his former consultant and the GP, and also find out in the area where she's living, because now the hospital have been grouped according to, I will give you an example. Basindi is under Omarton Hospital. Right?
Okay.
There's some hospital they don't have all the equipment, all the nurses and everything. So they will attach them under other hospital. She needs to know what kind of hospital
it's been attached.
It's been attached. Like Queen's Hospital, they has been attached with Royal London Hospital. We are working hand to manage ourselves, to support ourselves in care of the management, especially when any complication comes. So another thing she can do to go back to our consultant and say to our consultant, I haven't been managing, all my medication hasn't been given me. She just needs to give back and report back. You shouldn't keep quiet.
We'll advise her on that.
You shouldn't
give her a
keep
call
quiet.
after this. That's very important. Another thing is, some people want to know they've got sickle cell.
Yes, you mentioned I was going to ask that.
To later on. How is that possible? Because you know people with sickle cell, they've got sickle pain. You know, they go to hospital a lot. So how is that possible?
I think there is a lot of things I can say contributor to that. One I can say, when I said hemoglobin fetal, that when they cut the placenta of the mother and a child, especially a child that have a sickle cell, there is what we call hemoglobin fetal that is in placenta. Sometimes you might have sickle cell. All of us might have sickle cell. If I have hemoglobin fetal a lot in my body, I might not have sickling pain a lot because I have high infinity oxygen that I retain in my body that helping my red cell carrying the hemoglobin, carrying the oxygen because it's very high. It would behave like I don't have sickle cell. I'm just normal. I'm not having pain. Sometimes I might have a pain, but it might not be too much as you will have. So that will help me. Other things can help me. If I'm in a country like Nigeria, Ghana, where it's sunny, I'm okay sometimes because I'm where the sunny is. Remember, you are using vitamin D. I don't need to use vitamin D. And sometimes I can use vitamin D because it's vitamin. Not that I won't have pain, but I don't know what is wrong with it.
Maybe you're stressed.
Honestly, she's quite right. Because
you might not know.
Everyone knows I'm a warrior. I was born and raised in Nigeria.
Right.
And when I was in Nigeria, maybe I'll have a crisis like twice a year. A week, 2 weeks, I'm good. Like I'm back to normal, playing football, doing all kinds of things, climbing trees, falling down, all sorts. I'm doing it. And my parents, I'm so glad, they're very learned, educated. They knew how to manage things, However, when I moved to the UK,
the weather alone
changed. It really changed. Yes, it really changed. In fact, the first time when I officially relocated to the UK, within a week I had a crisis and I had to be rushed. I had to be picked up from my bed in my bedroom. Like a baby. Yeah, it was that bad.
It was that bad?
Yes, it was that bad. Yeah.
So are we trying to say that some country can have a bad effect?
That thing I want to say is that, back home, Nigeria, Ghana, remember mosquito. When mosquito is biting, the AS, people who have AS, they have a friendly blood with mosquito.
Really?
If I go to Nigeria and if he
goes with mosquito.
But I think sometimes misdiagnosis sometimes is a lot back home. When you sick, they categorize you with malaria and things like that. Instead for the clinician to say, you have been sick, you have been on and off and things, or you are anemic. They don't think about that.
So they treat you for malaria and typhoid.
Instead of knowing that you have sickle cell.
It explains it. Because I'm thinking this is cheating. How can you not know? Some people know when they were born and they've been suffering from this pain. And you just find out when you're an adult.
In your 20s or you're an adult. And you're just having a good time. It's like, I don't like you. You're too bad than I am. What's wrong with you?
It is
possible.
You're on this together.
It just goes to show anyway that everyone with sickle cell or a variety of sickle cell, everybody's life is different. It affects everybody in different ways.
And everybody tolerates their pain in different ways. Right. Some of the Nigerians as well in Ghana, I've seen a situation in Nigeria because I do have some people who are managed in Nigeria with sickle cell. Because anytime I go to Nigeria, believe me, I do raise awareness a lot.
Yes, you do.
So I have some people who are managed and whereby this person, I am the one who actually said, no, I don't think you are just malaria basis or you have a liver disease. They believe that you have a liver disease. Becoming jaundice, his liver is always enlarged. They didn't diagnose, she's 26.
Wow.
They didn't diagnose her as a sickle cell person. So what happened is that someone knows somebody, and they said, "Oh, can you help us? Do you think this person have this? They've been diagnosed and he doesn't have." Then I have to refer them to another specialist area where I know that they have a proper machine that they can diagnose. And I said to them they should go there. It is true you have enlargement. Sometimes when someone have malaria, it can trigger your liver to become enlarged. Definitely. So they are treating him like he have high vitamin B12 and all this. And I said, let's go and diagnose this person further. And I asked the gentleman, can you do this condition and this? And just, by the time they find out, he have sickle.
And sickle cell at the age of 20-something.
26.
26?
Yeah.
Wow.
And what triggered me is when I saw
his eyes.
Her eyes is very, very yellow.
Jaundice.
Okay.
Then I saw her leg. It would tell me description of a pain in her legs, and the legs is a little bit dark. And I said, even when I touch her leg, it's very painful. Sometimes it can be swallowing and everything. And always anemic. And I said, this is a typical sickle cell symptoms
so
for me.
The symptoms,
jaundice, swollen legs. Sometimes you can have a swollen heart. Any part of your body can be swollen. And the reason why your part is swollen, you know, when the sickling pain is coming, we told you that when the sickling blood is traveling, because that's what your body produces. Even though your red cell produce from bone marrow, when it produces, normal red cell live for 120 days. Then the sickling level live for 10 to 20 days, begin to break down, becoming sickling. So what happened to your red cell that is sickling? It can cause a cough and blocked the blood flow. At that time, when it's blocked the blood flow, any place that is stuck can be swollen. Very hot to touch, very painful to touch. That's what a sickling level.
So that's what we call crisis.
Okay. And that's what we call pains.
Okay.
That's what we call vaso-occlusion.
Okay.
Vaso-occlusion, that's what they call that. Okay. And when they are treating you, and they give her IV fluid or they will give her blood, everything is fine. I'm not saying, let her diagnose that to sickle cell. He said the doctor have already done it, and I said, okay. I understand it's AS. There's no. I said, let's go to another clinician in Bobby. And that's where they diagnosed me. And I have to ask them to tell me the sickling level. When they tell me the sickling level is another step that they will diagnose. Now they know that you have sickle cell. They wanted to know amount of the sickling level in your body. It will be like 80 plus. If you are a sickle cell trait, it should be like 45 to 50 or 50 to 48.
Wow.
But if you're a kind of person who are not on blood transfusion, you are just on normal sickle cell, your S level should be like 80 to 90%. Meaning that is what your blood generates.
Wow.
So early sign, we've mentioned anemia is a severe one. Anemia is severe one. Pain is a severe one. Dehydration, shortness of breath. Those are the symptoms. Early stage as well can be swollen body depending on the age of the child.
That's what families should watch out for.
And then also affecting the
organs, the spleen.
So is that why they have sudden swelling of tummy when you're going into crisis? All of a sudden your stomach becomes big.
Yeah, it becomes big because of the liver situation, meaning that sickling level, like I described for you, the blood flow, it can stuck in there and accumulating the blood just in there, and it will just become tender swelling.
Wow. This is so funny. I'm sorry.
Yeah.
This is so funny because I've met somebody who I actually thought was pregnant before.
Are you serious?
This person almost knocked me out. I'm serious. Because I was like, oh, congratulations, you know. And she looked at me like, what's wrong with you? I was like, oh. Well, I didn't know that she was having a crisis at the time.
Oh, oh my God.
So never assume a woman is pregnant, please. Men out there, never do it.
My God.
It's not a good thing.
Oh my God.
Yes.
Oh, she had swollen tummy.
Yeah, she had swollen tummy.
Any sign of crisis.
Yes. And I thought she was pregnant.
And most of female might experience that alone. Most.
So yeah, because
especially
I'm a guy and I don't.
Period as well. The sickness can cause a lot in that. Wow. It can cause them to bleed sometimes. It can cause them swallow, stomach, and things like that. When someone is having a spleen pain, that's what happened. Wow. Liver pain, that's what it happens.
Does that mean that the way crisis can present in a man differs to the way it can present in a woman?
I think crisis is crisis.
Yeah.
It can affect anybody anywhere, depending on the complication you go. But the only things that different from women to men in crisis is men, we have priapism, what we call erection of penis. That is different from men's one.
What's so funny? You're married with children.
We have to call a spade a spade.
Yeah.
We're on a life where people wanted to learn. Let's talk about it. Because there's some people who doesn't know about it. They want to know about it. And sickling is sickling, but people have sickling in a different level. But because some people have been placed through their symptoms, frequency of pains, and some people have been placed on some medication management, what we call modified management treatments. Modified management treatments could be hydroxycarbamide, might be blood transfusion top-up, it might be automated red cell exchange transfusion.
So these are treatments and medications.
Standard treatments that we have. Because people have been placed on it, pain crisis might be different. Because people who have automated red cell exchange might be using that during that time that they have the red exchange, they have oxygenated blood in their body. Their pain might not come until when they are getting to the time of the other red cell.
Of course.
People have top up as well, have oxygenated blood, have energy because there's more iron in the blood. So their pain might be different. Those are the things that might be different. Some people on hydroxycarbamide, it might make their pain different because the hydroxycarbamide itself is making the oxygenated blood increase, which is hemoglobin fetal. It reduces the frequency time that the patients will have in pain as well. And we increase hemoglobin. So people who are on this treatment might be different, not having pain every day. Pain crisis is pain crisis. Some people have pain crisis that can be a life-threatening condition. Acute chest is one of the complications. And we have another complication like stroke.
I've seen that in teenagers.
In teenagers.
I used to be surprised about that. Yes.
So I want to ask to the audience there that, when we're talking about sickle cell, who do you think is going to be experiencing stroke most? Is it child or adults? I would like to give you that question, audience. Get back to us on the comment side. Is it the child is going to be having stroke most as a complication? Really? Or is the adult? I want to know because
please tell us.
I wanted to know. I will leave that question for you.
We're going to leave our details so that you can get back to us.
Get back to us about that question. Is the child we experience symptoms of stroke most, or is the adults? And why do we think the child will be the most or adults? Stroke is one of the biggest complications. Acute chest is one of the bigger complications. When all your symptoms, we are talking about pain, it doesn't control, and you have pain in headache continuously, and nothing being done, and if you're stuck at home, you didn't go there. You don't know what you can resort to.
So something as simple as headache.
Yeah, because it can trigger headache. It can actually increase your blood pressure.
Yeah,
and blood pressure can lead to stroke.
I used to think all these things were not true until I dealt with issue in my job that caused repeated headaches, and it was horrible. It was pretty terrible. I couldn't, sometimes I wouldn't be able to look properly, couldn't look at lights, couldn't, talk on the phone for long, all these kind of little things that you do that we don't notice.
Things that you don't appreciate.
You don't appreciate, it just becomes so difficult.
Just do things. You don't know that people are really,
I'm telling you.
Oh my God.
So sickle cell basically affects you from top to bottom.
From head to toe. And I will tell you, we've talked about stroke. What about your eyes? Retinopathy at the back of your heart. It just as a result of the sickling blood flow that I told you. It can stop anywhere. It can affect your jaw and give you a necrotic teeth. The necrotic teeth will cause you to be having pain, removing your teeth, extracting teeth and every time and things like that. It can make you to lose teeth early. And when you go into your chest, cardiomegaly, because of anemic, making your heart to be enlarged unnecessary because you are anemic and you are not correcting your anemic. Because your blood has to pump blood. When you're anemic, there's nothing to pump. And the elastic of your heart will just be contracted and will become slack.
Is this what they call memo or something? Is that
the memo is like a whole, that one is different. But you can have a symptoms of memo when you have cardiomegaly.
Is this acute chest syndrome?
The acute chest syndrome now is as a result of lack of oxygenated blood in your alveolar, in your lungs, that it will be short of breath. your saturation, when we monitor your oxygen level, will be low. At that time, what happens is that you're having chest pain, but we call it acute chest pain, because when you're having chest pain at that time, you won't be able to breathe. You must stay in one place, because probably when you move is when the pain, or in your ribs or anywhere. Then when you're stuck in one place, you are groaning, you are not able to breathe in and out. That moment, your chest can be full up with air, with trapping, and will cause a lot of pain. And that is a big life-threatening condition. If you are having chest pain, you are out there, please, a chest pain that you have treated one time, like 1 day, 2 days, and you are increasing in short of breath, please hospitalize yourself immediately. Like, go to hospital and seek help.
Don't take chances.
Don't take chances. Go out there, go to the hospital, go to your clinician, go to your day unit, report yourself, let them do your blood test, let them do your observation. They will see, because it's one of the life-threatening conditions. When they have it, they'll end up in ITU. People
This
can
is quite
deteriorate.
depressing to hear,
and
you know?
it's
This is so depressing
but
to
this
hear.
is very real as well.
This
It's
is
very
someone's
real.
life.
Yeah, this is
It's
someone's life,
life.
like
Yeah.
from beginning to the
my
end. Yeah, I've also seen patients that can't walk. What is that?
Yeah, we are still listing the complication. We haven't get to the stomach yet.
Oh
So
my
there's
God,
still
there's
more.
a
We're still
lot.
here. Okay,
There's a lot.
Wow, we haven't get
We're
to the
not done.
no,
Oh my
because
God.
we're stuck in the complication of step.
Okay, we've not
so
gone
now we're going
half.
down. Okay.
Yeah, we are going down, because we say it's from head to toe. We've talked about the lungs, we've talked about the heart, then we get liver, spleen, your gallstone, your bile. So we got all that can be triggered, because we are talking about damage of organs. We're talking about our shoulder, joint pain, knees pain, hip pain. Sometimes when your pain is going like that in your joints, there's something they call necrotic. Vascular necrotic mean a vascular necrotic where your bone, because we said the red cell is produced from bone marrow, sometimes it produces a breakdown. Then there's no creamy blood, oxygenated blood. Then all your bone, as you are walking, is having friction, like you are
The
washing clothes.
joints. So your joint starts to wear off. That's why you have as vascular necrotic.
They call it AVN.
Can affect any joint.
Any joint.
Any joint at all.
Either shoulder, your hand, your knees, it can be in anywhere. So what happened that he has that, why are they limping, is when the pain now started, they want to be managing. If this place is paining, they will be using this leg, and that will be causing the limping. And sometimes they have to do what we call operation early for hip replacement. So there is a lot that people are going through.
I want to continue this.
It's become very
it's becoming very depressing. I'm beginning to feel bad and sorry for people with sickle cell. So I think I'm going to move on. There's this thing about the voxeler. Yeah. I heard that it killed so many sickle cell patients. Can you tell us about that? Is that true? Because it's out there on the internet. Really, not just saying this.
There's some new about
so can we talk about Voxel? Is it Voxel? Right?
Yeah, it's one of the medication that came out, and at the same time, it's being withdrawn from sickle cell. There's some other conditions still using it, but the sickle cell, they've withdrawn it from sickle cell. I want to say when we started it, there is quite a little bit people who benefited from it. In my clinical area, there is a lot of patients who benefit from it. And we are using it, different patients say different things. We notice everybody have different symptoms, right? But what you said is what they reported that has happened. And that is the reason why they withdraw it from the sickling.
I killed so many patients.
Yeah. So the so many patient figure might be, if it's one patient, it means a lot to us, because whatever affects one person could affect any other person.
Okay.
I don't know how many patients, to be honest, but I just understand that when it affects one patient, it means a lot. We should review whatever that affects one patient.
Okay.
Because if we have 10 patients and one lost, what happened is important. And I think that is the major reason why they withdraw it out. It's still on discussion. But I think it's during the clinical trials that the incident happened, right? But because of that, they overview everything and they said it is important we withdraw it, and that's why they withdraw it.
Okay.
Yeah.
Okay. We're talking about is it
What be this?
Cranzalizumab.
Yeah.
Why was it stopped? Because a lot of patients said it helped them a lot.
Not
Like
surprising,
that
actually.
treatment really
and
helped
it
so
came
many
off
people
very quickly.
Yeah, and it came out very quickly.
Yeah,
So many people said it was because the money was too much and they can't be bothered to use it on sickle cell patients.
In fact, some people actually complained that after they stopped it, it affected them even. Their sickle cell got even worse.
They were like, why introduce something they can't
and then take
keep
it
up
out so
with,
quickly,
you know?
Yeah.